Good morning, and thank you very much for asking me to talk to your Best Start, Better Futures workshop this morning. What I'd like to do is to split my talk into two parts. One is to talk about engineering better care, which is a new approach to thinking about systems, complex systems, and how we improve them. And in the second half, I want to come back and say, well, how might we apply that to your particular challenge of delivering a one council, whole family, whole community approach to tackling child poverty? So focusing first on engineering better care, this is something we developed about 5 years ago with the Royal Academy of Engineering and with the Royal College of Physicians and the Academy of Medical Sciences. And the exam question was to work with the health and care professions to explore how engineers can add to current understanding and practice of systems engineering and quality improvement in healthcare design. So from an engineering point of view, we might start with the idea that systems that work do not just happen, they have to be planned, designed, and built. And that brings its own challenges because often the systems we inherit, they develop. And it's really about improvement rather than design. And also from an engineering point of view, systems engineering view shown in this model is rather too complicated to try and express how we use this in improvement projects. So we went back and thought, well, how might we define a systems approach by looking from 4 different perspectives: systems, design, people, and risk. And what I'm going to do now is to say a little bit about what came out of the workshops we ran with health and care professionals to try and unpack those different perspectives. So people in health and care absolutely understand that systems of systems concept, the human body, the waterproofing system, the plumbing system, the neurological system, and so on, and that the performance of the whole is far greater than the sum of the parts. And yet, if you damage one of those systems, we have geographical damage, it does compromise the whole. But we can think of that in a slightly different way. How about the patient going to the GP to seek help for some particular medical condition? The GP might look at the formulary or computer software to put out a prescription, which the patient then takes to the pharmacy, have their own delivery and dispensing system to make sure that the patient then takes home the medication into their system. They ultimately have to manage, make sure that they take the right medication, the right dose, at the right time. And the questions that might arise out of this is, well, who are the stakeholders? Who are the people who have an interest in that system working? What are the elements or parts of the system? And how does the system perform? We move to the design perspective. This is a model called the Double Diamond Model from the Design Council. And what it really emphasizes is the challenge to explore the need to be able to define the problem before you explore the problem to find the best solution. And you can apply that to simple things like blood pressure monitoring equipment, to a piece of equipment within a complex array of equipment within the environment of theatre. Or it might be, it's a scanner for children, the GE750 scanner. You promise the child an undersea adventure. The rumblings of the scanner you put down to the engine room of the submarine. They're told to be really still and quiet so nobody knows they're there. And you end up with a happy child and a better scan image. And what you're really designing is the whole experience. Or maybe it's a defibrillator for use by the general public. Not only has the equipment got to work first time, but the instructions read by a novice, you have to be able to follow them correct first time. So the questions that might come out of this, well, what are the needs? How can the needs be met? And how well are the needs met? From a risk point of view, if we look at the outcome from any particular process, we'd expect the vast majority of outcomes to be normal. But we will be worried about the threat of accidents. But equally, we should be looking for the opportunity to learn from what we do that's exceptional. So in a sense, how do we move that curve to the right? If we were to study central line insertion for long enough, one thing you'd notice is if you interrupt the operator here at a particular point in the cycle, they may forget whether that wire they're about to grab is in or out of the patient. And whilst it doesn't kill people, it's pretty inconvenient to have to go back in afterwards to retrieve it. Equally, there's an infusion pump on the market where if you're trying to tap in 15.7 and you tap in 15.5, delete 7, you've actually tapped in 157. And that poor design of the infusion pump manifests itself in, looks like an error from the operator. And how do you apply these techniques to a busy ward, for example? They change over time. What could possibly go wrong? But equally, sometimes people just make mistakes. This is Hamilton 2013, just changed from racing from McLaren to racing with Mercedes. He comes into the pits for the first time in the race and he stops at the McLaren pit crew. And they quietly have to wave him on down the line to the Mercedes crew. So the questions might be, well, what is going on? And that duality of how could we do it? What could go wrong and what do we do well? And then how can we make it better? Then from a people perspective, we started by looking for diversity in the user population and in the provider population. And for example, why would you give somebody who's got arthritis their tablets in a child-resistant container? And what about that medication I showed earlier in the morning without your glasses on? How do you make sure you take the right medication at the right time? What about language? Are we clear, concise, and consistent in our use in language so people understand what we're talking about? And if we make changes in a particular team in a particular location, maybe on a ward, should we expect those changes to be viable on the ward next door or in a different hospital or in the region? Probably not. So the questions that might arise here, well, who will use the system? Where is the system? What affects the system? And all of these things are important: people, systems, design, and risk. It's a bit like the juggler. The performance is only complete if you keep all the balls in the air. And we can capture all those questions in one place. And it's a cyclical process. And you might start at the top and go around clockwise. The majority of the questions on the right are about trying to understand what the problem is. The majority on the left, trying to find the best solution. And we can apply that to an improvement task where we're trying to go from the current performance to something measurably better. There might be a number of stages we go through along the way. And the idea might be that we wrap those questions around that process. And early in the process, we predominantly look at those right-hand questions, trying to understand the problem. We shift the emphasis towards the left-hand questions later on to try and find the best solution. And other observations we found was that people were surprised that engineers think about people. It's what we do all the time. And we think about iteration before implementation. We think of design as an exploratory process, trying to search for the problem before we search for the best solution. That risk management is a proactive process. What could possibly go wrong, as well as, well, what went wrong? And then this idea that thinking changes practice, those use of questions to change the way we think. But as you see later, maybe a little bit of process might help. And if you think that there's nothing new here, you're probably right. But yet common sense is not common. And out of all of this, we developed a simple toolkit to bring all these ideas together. And it really is asking just two questions. How can we do it better? What could possibly go wrong? So that brings me then to the second half. And how do we apply that to your particular challenge of delivering one council, whole family, whole community approach to tackling child poverty? So how do we think that systems thinking can help? So if we then unpack that toolkit and look inside, there's a whole bunch of tools and techniques that we've put together to help us answer those two questions. And we start with that same cycle of questions that you saw before, but add just that element of process. So those key stages of how do we understand the context, define the problem, develop the solution, collect the evidence, make the case, manage the plan. And all of that predicated around agreeing the scope. And again, it's a cyclical process. And we can apply that from the same program that I showed before, where we're trying to go from the current performance to something measurably better, potentially in a number of stages still. But to do that, we need to know, what do we do now? How do we perform now? How could we improve? What should we measure? What is the case for change? And then what do we need to do next? So that adds a few questions to the mix. But again, the dominance of the questions on the right-hand side is trying to understand what the problem is, and those on the left-hand side, how we solve that problem. And I can superimpose those questions around that process model. So how does that play out if you're trying to tackle the particular problem you're looking at? And we're right at the front end of that process, looking at the current performance, trying to understand what's going on, and wondering, what do we actually do next? So the way this workshop's been set up, we've started in a sense by asking that question, who should be involved? And since you should be involved by just looking around the room, and we've tried to draw in people so we can put together different teams to look at different challenges. We want to look at how to support more parents into employment, which pays a living wage, how to close the gender employment and pay gaps, how to address the rural poverty premium for children and families. And then 3 more teams to look at how to deliver a one-door approach to connecting children and families affected by poverty to the services and support they need within particular localities. So that's, in a sense, we say we probably do have the right people in the room to look at those challenges. Then what we might want to add into that is 4 key areas which are important to look at. One is to say, well, who are the stakeholders? Or who will use the system? And what are their needs? So the first breakout session, you can look at how you identify those internal and external stakeholders, particularly ones that are less obvious. And for each one of them, what are their particular needs and why? The second session, you're going to focus more on the challenges that people face. You're going to look at the user journeys, try and map them out, identify the barriers, the challenges, and also the things that go well. The third session, you're going to come back to the context and look at that system map. Try and figure out, what are the elements of the system? Where is it? How do they connect together? Can you sort of piece together that puzzle of what the system actually comprises? And then in the fourth session, we use a process of storyboarding to dream a little, to try and understand, what does good look like? And what story would we want to act out to ensure that that's what we achieve? So all of those things put together, we're going to ask quite a few of these questions through the rest of the day. And of course, that leaves others yet to be asked. But those in combination will help you on this journey to begin to understand, what is that current performance? What is the current system, the current challenges? And how do we move across to something that's measurably better? And just to give you a little bit more confidence maybe in the application of these tools and techniques, currently we're applying them with Scottish Government, looking at the development of a heating buildings environmental policy to govern how we might move from from gas boilers to electric boilers. What challenges that make, and what mitigating processes need to put in place to help people with that transition. At the same time, we're working with Lancashire and South Cumbria, 5 healthcare trusts there, looking at how we challenge the way they do healthcare systems improvement at 2 levels. One, at looking at particular projects, like how do we better serve multi-morbid patients? And secondly, how we actually improve their whole approach to improvement. And there's many other areas of government around the UK that we've been supporting using the systems approach, and many other elements of healthcare we've also been looking into. So I hope you enjoy the rest of the day. And if you have any questions about what I've just spoken about, then please just ask.